Well, I had been a practicing general surgeon at Aultman since 2010. And after the first few years, I realized that there was a big need for someone who specialized in breast cancer patients. We no longer had a fellowship-trained breast surgeon at Aultman Hospital. And there was a big need in the community. Women with breast cancer, they need specialized, focused care. Breast cancer is always changing. And you need to have someone who's really focusing on it so that the women, and even sometimes the men, get the best treatment available. One of the things when, especially dealing with women who have breast cancer, the breast is such an integral part and so closely related to a woman's identity and sexuality. It's a very emotional subject. We end up spending a lot of time with women, sort of counseling and being very supportive, a lot of educating of patients and their families about the different treatment options with breast cancer and the different parts that go along with it. Now, some of the new techniques that I offer are being able to do a mastectomy and being able to preserve the nipple. It's actually, preserving the nipple is a very emotionally charged area because for women who have reconstruction, if they still have a nipple, when the reconstruction is done, they feel complete again. And it looks like a normal breast. And it gives women a lot of feelings of like, okay, like I got through this and I'm back to looking the way I did before. The breast center has a radiologist that's there, so I'm able to review the images with the radiologist for all of our cancer patients. And that allows our patients who have breast cancer to get a very thorough review of everything to make sure that nothing's missed. The radiologists are all fellowship trained. They're wonderful, caring, compassionate physicians, and the team up there is wonderful. Everyone cares so much about all of our patients. It ends up being one of those places where we seem to give a lot of hugs to our patients just because sometimes you just need a hug. And it seems like you need that a lot when dealing with women with breast cancer. It's a great place to go to get full, complete, comprehensive care, and you can get so many things taken care of in just one visit. So we are hoping on continuing to expand. We're very excited now that Aultman Hospital is open up to so many different insurance plans, that there's so many other women in the community that can come to see us. I'm very excited that I'm the only fellowship-trained breast surgeon in the area, so that way we can help treat all of the women in this area with the most current and up-to-date care. I love being able to spend time with the patients and their families. We really sort of connect and grow. We make a great relationship. So I know about them and their family and their kids, and they know about me and my family and kids. And we all just sort of grow together. I'm a Northeast Ohio girl. I grew up in Mentor, which is one of the eastern suburbs of Cleveland. And so for me, coming to Canton was close to coming back home. When I was a general surgeon, it was the closest I could get to Cleveland because everyone in Cleveland is subspecialized. And then when I found the Canton community, I loved it. My husband and I just loved the area. We love the people. We love the fact that there's lots of things to do here, yet it's still a little bit not as busy and hustle and bustle. And so we have our small little mini farm where we have some alpacas and ducks, and being here gives us that space to have that area where we can have a big garden and raise some animals, and it really is that perfect balance for us. I guess I'm really fortunate. I have 2 young girls and a wonderfully supportive husband at home, and he helps me so much with everything at home that I really have the chance, and I can just focus all of my energy when I'm at work on work and my patients, and so that's been really wonderful. And then when I go home, I can be mom, and then when I come to work, I can be doctor.